Hello, David. This is John. Thank you so much for your excellent response to the prompt. I thoroughly enjoyed reading it and I learned a lot. I'd like to piggyback, though, on something you said. So I'd like to quote you. You noted MAT for alcohol and opioid use disorders is not just a substitution of one opiate for another. It is a broad therapeutic approach that is most effective when the prescribed use of medications is combined with psychotherapy to treat alcohol and opioid substance use disorders. And I agree with you wholeheartedly, 100%. However, truth be told, I can understand why a non medically trained mental health provider may view the pharmacological component of MAT as substituting one opiate for another, because even as we are learning in the context of this class, there are certain FDA approved medications like buprenorphine and methadone, which are opioid agonists. But we know that the body responds to these medications differently than the opioid agonists that are often abused, like oxycodone or morphine or even heroin. When these illicit opioid agonists are introduced into the body, we know that they activate certain opioid receptors on the surface of cells, and they cue these cells to perform certain functions, causing a cascading effect of bodily processes, including a euphoric high or pain relief or even respiratory depression. However, when buprenorphine or methadone are used to treat opioid withdrawal symptoms, while they might be effective in satisfying the body's craving for opioids, unlike these illicit opioids, they do not cause the euphoria and they have a slower effect on the brain. There is, in essence, a blunted effect. Actually, I came across an article, and this article referenced the result of surveys on people with opioid use disorders in America. And based on the results, it was noted that only a small percentage of people use these FDA approved medications illicitly to get high, some 8 to 25%. And this seems to suggest that people are beginning to abandon the goal of getting high on these medications after they experience the drug's blunted reward effects. It seems then, at least to me, that there is a clear distinction between the effects of illicit opioids and the opioids that are used to treat substance abuse disorders. I hope this helps a little, and thank you so much for your response, and God bless you.